Go for it.
Hello, everyone. My name is Dr. Lawrence Field. I'm a professor at the University of Texas, San Antonio in cutaneous surgery and oncology. I'm going to talk to you, young people, presumably, about liposuction. Liposuction, dermatologic liposuction surgery, is a different thing. Now, liposuction surgery began really in the world about 1976, although there were antecedent people that played with it. But in 76, two Hungarian physicians published a paper in the Bulletin of Cosmetic Surgery, and I read it and decided I would attend a live workshop being given in Paris in 1977 in the offices of Dr. Pierre Fournier, a wonderful friend of dermatologic surgery. Now, Dr. Fisher and his father, Arped, are the originators of liposuction surgery, modern, and they came to Paris to Dr. Fournier's offices with their cellulosuctionatome machine, which was inserted and sliced off pieces, especially in the area of the female of the lateral thigh. They had a lot of hematomas with that procedure, but it was the first procedure able to be done on women, primarily, with a particular defect and help them. Now, gradually, people became interested in that. I was fascinated, came back and immediately began to disperse that knowledge in the area I practiced. That was under great resistance. No one wanted a dermatologist to do liposuction surgery. It was too difficult. It was too extreme. All kinds of electrolyte problems they couldn't handle. So one of us, Dr. Klein, now of California, who was a dermatologist and an internist and a pharmacologist, gradually evolved the concept of doing the procedure under a dilute lidocaine anesthesia with epinephrine, the world famous Klein solution now adopted by many specialties. You can find that formula anywhere you look, you'll find it. It was improved, in my opinion, by increased concentration of the lidocaine by Dr. Patrick Lillis of the University of Colorado, now retired. I had the privilege of being with Dr. Klein when he was at Dr. Lillis's recent wedding a few years ago to a lovely lady, Tracy. Well, this art instrument right here has some little holes in the bottom and it's flat. This was made by Dr. Klein in his garage. That's where he used to make his instruments. To make it very simple, systems now exist where you can take a syringe, plastic syringe, attach it to an instrument, insert it into the body wherever you want, pull this back and establish suction by different means, and then back and forth, back and forth, back and forth, obtain fat in this area, which you can then hold upside down, and the fat floats up in different areas, so you'll have layering of fat, blood, etc., that you can eventually have only fat left in your syringe, that you can do fat transplantation. Every dermatologist should be able to do fat transplantation. It's criminal that patients have to pay for fillers when you can simply get proper syringes, proper entrance instruments. I'm not telling you it's easy, but it is easy. You just have to have the right instruments and the knowledge to do it, then to harvest yourself an increment of 5 cc's of fat or 10 cc's of fat and put it into a particular defect. It does not take a plastic surgeon in a hospital under general anesthesia to obtain fat for a fat transplant. That is terrible, terrible. So, all of you should learn this, all of you should do it. Dazzle offers free liposuction courses at its annual meetings. You should try your best to find someone who does the procedure as originally described by Dr. Fournier, syringe liposculpturing. Liposculpturing, not just removing, but sculpting a patient if there's too much, to make sure their contours are right. If their contours are depressed, to put some more fat in to raise it. All fat does not live in the transplant. So you have to tell your patients this may take 2, 3, 4 episodes to give you a permanent improvement in your depression. One will not do it. If you start that way, they accept it. You also tell them no patient, not one, anywhere in the world has ever died doing liposuction our way. Our way, not their way. There are very definite programs set up for people to learn this. So, thank you, good luck, Godspeed in your dermatologic liposuction surgery careers. Thank you.